Hello everybody, my name's Dr. Shireen Hardman and I'm the menopause specialist here at the Health Suite. So today I'd like to talk a little bit about HRT because I get asked a lot of questions about how to apply HRT. And yes, it does matter how you apply it, and no, not all HRT is the same. So you've got the patches, the gels and tablets. So what's the difference and how do you apply them? Here are some golden rules that may help you and some practical tips. So let's first of all talk about the patches. So the patches are, for example, Everol. You apply them below the waist and away from the genitals. The edges can become a little bit, don't adhere so well, so make sure you actually hold it down for at least 30 seconds and that will help the patch adhere to your skin. This needs to be changed twice a week. Make sure you rotate the sites where you apply the patch. A lot of women do complain that the patches can leave a little bit of the glue residue around the outside of area, and to get rid of that you can use some alcohol wipes. A lot of women prefer the patches because it's one patch twice weekly, and also the advantage of the patch is it can deliver quite a steady dose of hormone to the body, and this is really useful for women who have migraines. Some of the disadvantages of the patches are they can leave that residue I discussed, and also some women don't like the idea of being able to visibly see a patch. So there is obviously Estrogen as well, and a lot of women are using these. So this is a gel-based product which contains alcohol, and depending on what your doctor prescribes, it can be either 1 to 4 pumps, depending on what's prescribed by your GP or your menopause specialist. So with regards to the pump, it's 1 full pump, and you need to apply it to a large area from your arm down to your wrist or your inner thigh. Now the important part is it's got to be over a large area, so you actually distribute your medication over that area, and this helps with actual absorption of the product into the skin. Again, please make sure you allow time for this to dry, and because it contains alcohol it can dry sometimes better in the summer months rather than the winter months. A lot of women do notice that, but it's really important again that you wash your hands thoroughly and allow the area to dry before going and hugging your husband or touching your children or giving your children a hug, because obviously the medication can be transferred onto other family members. And of course the last type of HRT estrogen that we do prescribe, and less so now because we tend to stick more with the transdermal estrogens. However, there is a place for tablets. The advantage of tablets, well, they're easy to take, but you still need to remember to take them exactly as prescribed. And try and remember these at the same time every day. This helps improve compliance, helps you remember, and also helps to deliver that steadier dose. So with HRT, alongside the estrogen, if you have a uterus, you do need to also take progesterone. And this is very important for endometrial protection and obviously to prevent abnormal cells forming inside the lining of the womb. So let's talk a little bit about the different progesterones available. So one that we often prescribe is something called Utrogestan. Now this is a micronized progesterone, and it's the most body identical type of progesterone we have. This can be taken orally, but also it can be taken vaginally off license. And again, that would be normally initiated by a menopause specialist. So with regards to the Utrogestan, if it's taken as an oral tablet for somebody who's still having periods, it's taken as sequential HRT, which is 2 tablets for 2 weeks of the cycle. If it's taken by a postmenopausal woman who's completed her periods more than 12 months ago, it's taken as continuous HRT, and it's basically taken every night for the duration of when you're taking HRT. Now, with the Utrogestan, the important thing here is that it can cause a little bit of drowsiness, hence why we always advise women to take this at night. And that can be quite a beneficial side effect for women that are actually struggling with their sleep during the perimenopausal and menopausal years. And lastly, the dose of progesterone actually needs to reflect the dose of estrogen. So the higher your dose of estrogen, the higher the dose of progesterone needs to be. And again, this will be determined and you'll be guided by your menopause specialist or your GP as to what dose you need to be on. So I'd like to talk about the Mirena coil. Now, the Mirena coil is a great form of progesterone for women who are in their perimenopausal years and wanting HRT. It involves a procedure where you put the Mirena coil inside through the cervical canal into the vagina, and it's a fit and forget. So the license by the FRSH has extended from 4 years to 5 years, and it also obviously, the Mirena coil provides contraception for women up to 8 years, and it can help lessen heavy bleeding. And that would then be given with something like the Everol patch, as we discussed, or the estradiol gel. There are some side effects, obviously, with the Mirena coil, and that can be things like acne and mild fluctuations in weight and perhaps a little bit of breast tenderness, all related to the fact that the Mirena coil contains a synthetic form of progesterone, unlike the Utrogestan, which is more body identical. Let's talk a little bit about the patches. So you can obviously get progesterone in patches, and this for some women is a really useful way of delivering their progesterone element of HRT. It can be in a combined patch such as Everol Conti, and again, women like them because you can apply them below the waist and you can apply them and forget all about them, change them twice a week, and that's both your estrogen and your progesterone delivered. The slight difference with this patch is, again, it contains synthetic progesterone rather than the body identical Utrogestan, which is linked to perhaps a few more side effects, but not for all women. So the type of progesterone that you are prescribed very much depends upon you and your individual symptoms and obviously your medical history. If you're struggling with your sleep, Utrogestan is a good choice because, again, that's going to help you with your sleep. If you are struggling with heavy periods and you're needing contraception, the Mirena coil would be a good option. If you want something where you can just not worry about it and something that's combined together, well, the combined patch such as Everol Conti is a good option. So ultimately, there's lots of different types of progesterones and estrogens, and that's where I come in. My role to help guide you through what's the best option for you given your medical history and your preferences.